I don't even know. I didn't even know there's 3 categories.
STIs? What are STIs?
No.
Can you give me a hint?
Categories. Like what?
The 3 categories.
I have no idea.
Anal, urethral, and oral.
I don't know.
Internal, external, and gooey? I don't know.
I can think of 2, bacterial and viral.
Can I name how many?
I have no idea. I just know like HIV and AIDS and that's it.
So, you can get a UTI, right? Urinary tract infection. Can you get that from sex?
Are STIs and STD the same thing?
I think that counts, because you can get it from having sex. Okay, whatever, fine. Chlamydia, gonorrhea, herpes, scabies. How many is that for?
Herpes? And a yeast infection? No.
Chlamydia, gonorrhea, syphilis, AIDS, I guess, or HIV, and
Chlamydia, gonorrhea, herpes, HIV, AIDS, and pubic lice.
AIDS stands for acute internal disease symptom. No, wait, not symptom.
AIDS is autoimmune disorder. No, just kidding. I don't know. Wait, AIDS is the. Oh my gosh.
Yeah, I really don't.
Papillomavirus infectious virus.
HIV stands for something virus.
American infection. Okay, that's really bad.
HIV or AIDS is autoimmune deficiency syndrome, and HIV is, I want to say human papillomavirus, but that's definitely HPV.
HIV is less serious and AIDS is more serious.
Oh, AIDS is like the more intense kind.
I'd say HIV is like
HIV. Oh wait. No. I feel so uneducated.
HIV is like the virus that, I don't want to say makes AIDS, but like...
The HIV is like the virus, is that right? And then AIDS is the syndrome, like once it develops for a long time. I don't know. Do you want me to guess? 3 weeks?
12 weeks.
Isn't herpes like, they don't have a cure for it?
Don't you have it forever?
How long does it last? Viral. The rest of your life.
I thought, isn't it like, it's kind of like pubic lice, or is that something else?
It sounds like scabs.
I assume it's transmitted through sex since it's a STI.
I've never even heard of scabies.
Scabies, I've never even heard of that, but it sounds like a topical disease.
I thought that they were parasite. Scabies. And It's just from unclean areas, and can they like get into your skin and they burrow?
Uh, 25?
25.
I'm gonna go with 25 just because it's the biggest number.
Is mono one of them?
If you have like an open wound or something in your mouth, if you like cut in your mouth and any transfer of saliva.
If you have cuts in your mouth, right? But not like just saliva.
Mono. No? Herpes? Yeah, herpes.
Only this semester because I'm taking human biology.
Well, obviously you just taught me what an STI even is. So in middle school, we hardly learned anything just because the teacher who taught us was so old.
Not really, not formally, not through a class. Oh, well, biology, a little bit. Biology, but not really, like, there wasn't a lot of focus on it.
A little bit in 7th grade. They didn't really like touch on it. They were just kind of like, you can get gonorrhea and chlamydia. And then I didn't really learn about them until I took classes at Solano, like a human development class.
Basically, I mean, you learn more in college and school. They're kind of like, well, we don't want to tell them how to be safe because then they're going to start doing it. So then I guess people contract a lot of diseases in high school.
I don't think we ever actually learned specifically about, you know, like specific ones, but yeah, it's basically just don't have sex.
A lot of people aren't aware of, even if they are infected, they aren't aware of what it looks like or what it feels like or anything like that, so then they don't get treatment.
Like, the best form of birth control, I think, is to like show somebody an STD or show somebody giving birth or something, so yeah, I think people should.
Yes. Well, I'm in college and I know people that are like, what? You can get STDs like that easily? I don't know. Or like, I didn't know you could get that from having sex, or I didn't know you could get that from having oral or something. It's like, well, yeah.
Yes, I definitely think people should be more educated because it can happen to anyone. Like, you can think you're safe and take all the precautions, but in actuality, you don't need to be, you know, doing certain things or, you know, be a certain person. You can get it. Like,
Definitely. Just because everybody's into pleasure, that's why we live. And if you want to have fun, you got to be safe.
Yes. I'm already like, it's already in my student planner for your spring semester next year. Obviously, I don't know enough about these kind of things, so it definitely could be educational.
Maybe. If the pictures aren't too gross.
I'm super interested in like the body, so anything that has to do with the body, I would totally do it.
yes, definitely, because just to know more, because obviously all these questions I like didn't know the answer to, which is kind of scary when you think about it, because there's 1 in 4 is a lot.
Yeah. I would know what scabies looks like. I think it would teach you a lot about different things.
Why, yes, I would. Just because it's like a more in-depth thing. I mean, you have the book, and so you can see all the different pictures and then get the, I guess, precise like illustrations plus the descriptions with it. And so it's just more of like an in-depth learning.